Welcome to the Martina Tierney Podcast. I want to ask you a favour. If you like what you hear, would you like, share and subscribe, because that helps us to get the message out and for people to hear the wisdom of all our guests.
And what I'm hoping to do by setting out a vision and giving people a model of change is to say, if you invest something sensibly here and your colleagues elsewhere in the trust benefit, most importantly if the patient benefits, that's worth doing.
I'm delighted to be joined today on the podcast by Mike Farrar, saying your name right?
Yeah, that's it.
The Permanent Secretary for Health for Northern Ireland. You're very welcome to Seating Matters.
Thank you, and thank you for inviting me.
Not at all, it's a pleasure. So unfortunately we're on a bit of a time restraint here today, so we didn't get showing you around the factory, but what are your first impressions when you did come in?
Well, I've just joined the morning's meeting, and it is just so inspiring, Martina. The commitment, the staff, the fun, and just you can sense that people take pride in their jobs, get value for it, and as a consequence, people of Northern Ireland and across the world are getting brilliant seating in healthcare situations. What's not to like?
So we have introduced Lean a long time ago, about 15 years ago, but it's a continuous improvement. So every day people make an improvement or a few improvements. How do you see that you could bring that to the health service? I know it's a big organisation, it's a big challenge, but is it something that you would like to do within the health service?
Well, without being critical of our staff, because our staff work incredibly hard, what I saw here was this idea that I have it in my power and control to make something better. It might be a really small thing or it might be a significant thing. And I think somehow in the healthcare system we've lost that sort of leadership that gives people a sense of, first of all, the responsibility to see what could be improved, but then that kind of agency to do it. And so I was absolutely blown over by the kind of commitment and just thought if we could do something similar at scale in the health service in Northern Ireland, we could make a massive improvement in terms of people's care. So I'm kind of fired up and inspired to go back and see what we can do.
Very good. You have said in the past, that Northern Ireland could be one of the beacons of healthcare, that does have a lot going for it. Just tell us a little bit more about what you think about the service here in Northern Ireland.
Yeah, well, we spend per head of population as much as they do in England and more than they do in Scotland and Wales. So we know within the same system, effectively, we're not getting the value for money because we're not getting the same outcomes that they get. And so my job's really to come in and think differently and to see what we could improve. And we set out a plan to try and do that. But I need to have a way of working where people believe that and are committed to that, because very often it's not the what of it. Sometimes we've always known the what of it in Northern Ireland, what we should be doing, but we've never really mastered the how of it. And what I think you've shown me here is this idea of the what being the chairs and the quality, and the how being apply a methodology to the way in which you take pride in delivering that. And so reliability of healthcare, if I take that, is one of our 5 key pillars, along with trying to get to people earlier, shifting our work away from hospitals into communities, using our data and insights, and funnily enough, attracting inward investment into our economy for health and life sciences development. So I can see this, it's a fairly simple plan. The trick will be, do we have the leadership and the courage to implement it?
And how, I know it's a big question, but how do you think you're going to go about getting buy-in and the leaders to work with you? Because it's a big question and it's not an easy task, but have you an idea how you're going to do that?
Well, I think you need a compelling vision. And again, coming here today, so many parallels. I see your compelling vision is not to provide Northern Ireland with better seating. It's to furnish the world.
Yes.
And I love that big, hairy, audacious goal. And I think what I'm trying to do for Northern Ireland is to say, look, we might be behind the pack at the moment, but actually we could be ahead of it. And wouldn't that be wonderful if your loved ones, or even yourself as you approach old age, faced a future where you could live independently for as long as possible, away from hospital care, feeling good about yourself with friends and family around you. And so we need some kind of vision, and it has to be a compelling vision. And then we need to be able to put our resources in the right place to make sure that vision happens. And early wins always helps.
Yeah. And I've heard you speak before, and you said that like there isn't any more money. It's just about looking at how we spend the money and shifting that. That's really the approach you're taking? Maybe shifting some of the budget out from acute care to the community.
Exactly, yeah. We're trying to move around 2% of our budgets from hospital to community each year. That's around £50 million a year.
Yeah.
And if you think about what you demonstrate here, and look at the avoidance of pressure ulcers, pressure sores, on the back of an investment in a higher quality chair that looks after people's distribution of weight, etc. And all of a sudden you've saved that kind of money because you've invested in some capable equipment, and that's avoided the huge cost that pressure sores, make to Northern Ireland's budget. So I even just here, in a very small example, but an important example, you can see the potential to put money into something different and get your value back across the rest of the system.
We do audits in hospitals, acute care, and we let the people there, the leaders there, the staff there, see the benefits for themselves. We're not coming and imposing our beliefs on it, although we have complete, confidence in our own product and what we're doing and our system, but we let them see for themselves, and that's the best thing. There's just there's another problem I see within healthcare across the UK, not just in Northern Ireland, because we work across the UK, is that they're very narrowly defined budgets, and that is a problem. Is that something you can change, or is that something?
Well, healthcare is very fragmented. The workforce is fragmented, often called tribes. With our nursing, our therapists, our doctors, our administrators working in these kind of siloed ways. And our budgets operate very similar. Interestingly, in Northern Ireland, because we have integrated mental, social and physical health trusts, effectively we should be better at that, which is another reason why I believe Northern Ireland could be ahead of the pack rather than behind it. And we have to challenge that. And what I would say to you in terms of if you have to invest in one bit of the health system but somewhere else saves, chances are it doesn't happen. If you have to invest now but you save later, chances are it doesn't happen. So you have to change the mindsets. And what I'm hoping to do by setting out a vision and giving people a model of change is to say, if you invest something sensibly here and your colleagues elsewhere in the trust benefit, most importantly if the patient benefits, that's worth doing. So let's think system, let's think horizontally, not vertically, and let's embrace, sort of like some of the opportunities of innovation, like the kind of things we've seen today.
Yeah, because the managers or the leaders, they're sort of protecting their own budgets instead of looking at it from a larger. The other thing is, what about having we have like yearly budgets, don't annual budgets at the minute? Is that right, Northern Ireland?
We do, yeah.
Are we going to work towards a more pooled 3-year budget?
Well, that's the theory, and of course, what I've seen. Again, I keep referring back to what I've seen today because it's like a microcosm of what we could do in a health and social care system. You took half an hour at the beginning of people's working day, or it would have been had you not saved it for when I arrived. And that half an hour is half an hour where you're not producing anything, but the value of that. And far too often when I go into healthcare facilities and I talk to people about change, they say, well, we're just too busy. We haven't got the time to stand back and think about how we could do things differently. And that is so the wrong thing, because that half an hour thinking about what you could do differently can make all the difference in the world to patients, the way you do your job. And so we need leaders who value standing back and thinking, is there a better way to do this? Because there very often is. Yeah.
That's one of the things we talked about earlier, and we embed and we fix what bugs us. So if we do something on a regular basis that really is holding us back or is bugging us, if you stop in your 3S time and fix that, well, then that makes that job easier for the day after and the day after that. The other thing we talk about, and want your opinion on this, is value versus non-value. We talk about that a lot, and if you had a time to go around the factory, you'd have seen value is when you're changing or when you're doing the job that the customer or the patient wants you to do. So one example of that is, if I'm a physiotherapist and my value is in when my hands are on that patient, but all the non-value is setting the clinic up, doing the paperwork, cleaning up, doing all that. Do you find within the health service there's a lot of non-value?
Sadly, yes. I mean, the interesting thing there is where I have seen lean applied into healthcare settings. And what tends to happen is people go through their process loops and they find, well, why are we doing this? And a lot of the questions that I think unlock that potential to have more value time and take out non-value is when you just ask the question, well, why do we do this way? I mean, very often, again, people will say, well, the technology helps you take out the non-value stuff. But actually, technology only works where people have got the mindset to adopt it well and sensibly and use it properly. So I think there is scope to do that. I also think we need to give people thinking time, like I've said, to work out what they could do. And I think we have to sometimes value the informal in caring settings over the formal. So very often, I mean, it's a personal story, but I used to go and see my mum before she died. She was in a very nice care home for the last three months of her life. But on a Friday, I'd go in and the ward manager would say to me, oh, have you come to see your mum? Sit down, we'll get you a cup of tea. On the Saturday, the ward manager, who was generally a different one, would say, have you come to see your mum? Sit down, have a cup of tea. We had a few questions about things that happened with your mum this week, and we wondered if you wanted to know about this. And she spoke about Uncle Reggie and what do we do about that? And all of a sudden, all discretionary effort took a little bit more time, but I probably was able to give them information that helped them care for my mum. Yeah. And so in healthcare settings, the value of your task, but also what do you wrap around that gives you real compassionate care. I think you get the sweetness of both of those aspects by valuing that, but you have to take out the non-value time.
That's right. Value versus non-value is a big thing for us here. So I know you're in a hurry and I know you're a very busy man and you're leaving very soon, but I just want to give us a wee quick overview of your neighbourhood reset, what that's like and how is it working? Because it's already established. How is it working?
Yeah, first of all, I'm really sorry I've got to leave. I am going to see some more health facilities and I've just loved being here, just to say that on record. Mm-hmm. So the neighbourhood really is this idea that we do so many things in hospitals that really should be done to support people living in their own homes ideally, but even if they can't do that, in care or residential settings. And really it starts with bringing the community around you. So very often people think about what happened during COVID. We looked after our neighbours, families supported each other. And where people have done this kind of thing around a neighbourhood model before, what they've often found, places like Wigan that famously did this well-researched programme that they put in place, was that they were spending less money than their budget on social care, which is unheard of, because you started with informal support. But then identifying people with the greatest needs, and so using the data that we have so that the general practitioner, the community pharmacist, the voluntary sector, local government, people like yourselves who contribute by supplying healthcare equipment, coming together and saying, what is the solution for this individual? And if you think about the person first in a neighbourhood setting, chances are you can avoid that hospital admission. If you avoid that hospital admission, you save that bed and that budget, which we can either spend on people to reduce their waiting times for care, or we can release the cash and help Northern Ireland not have to keep on spending more of its budget on healthcare. So it's a win-win. We have 17 neighbourhood teams. Okay. And they're just coming into play, so everybody should have one. And we really think they'll focus on those people with greatest need. Our first year priority is older people because we spend a lot of money. So I would imagine we'll spend a bit of time talking to yourselves about how we could invest that extra money coming from hospital into community settings for people like yourselves.
Well, thank you so much, Mike, for coming. It's been a pleasure to have you, and best wishes with your plans. They sound really just what Northern Ireland needs at the minute, so thank you for all the work that you do.
Oh, thank you so much. It's been a great lift. Thank you.
Thank you.